The types of this type of docking will be simple, flexible, also, and easily can be give the result directly. Series 1. There are many borohedral compounds were synthesized using this method via acid or benzoic acid derivatives with the alkaline, and finally using silver nitrate as nitrated agent. Also may be used another steps for the pyridine derivatives or the acid chloride derivatives. This is the identification for a number of the compound. We select the first one will be the proton NMR and carbon-13 derivatives. This is a chart for carbon-13 derivatives for the halo compound for the furans ester. Series 2. Series 2 used with the, as we mentioned, all amino acid derivatives, except glycine, we have no stereochemistry, as you know. And after that, we using dipeptide using DCC and nitration with the AgNO3. The design used for the theoretical calculation should be used the lowest energy for the docking using many types of receptors, using COX-1, COX-2, nitrocoxide synthetase, and induced nitrocoxide. The energy will be calculated, all of them in the caloric mode. We take in the lowest energy is the best, the compound and more stable for the docking. This is a simple one for the docking with the induced nitric oxide synthetase with the minus 226 kilocalorie per mole. This is another one, will be less stable because will be less, minus 180 kilocalorie per mole. This is with the COX also not be active because the energy not stable. What about the mechanisms? There are two types of mechanism can be used, either used with the CS2 and alkaline cyclization, or can be used as aldehyde directed with the alkaline. In the first reaction, the mechanism can be taken for the SS bond K with the heat, then cyclization take removal of H2S, and the H2S can be trapped after reaction in order to prove or identify the cyclic compound. Some physical properties for the compounds, for the heteroatoms using for the R with the dipeptide compounds. Also in series 2, as we mentioned with the dipeptide using the L amino acid can be used for the thionyl chloride with the haloethanols in the nitration with the AgNO3, the same method, or coupling a dipeptide using DCC with the NaOH. There are two proposed mechanisms. We select the first one because it is more stable. The mass spectrum, we select for the mass spectrum for one compound. And this is the physical properties of the dipeptides used. Finally, series 3 can be used in hydroxy alcohol were synthesized via direct condensation of cyclic ether epoxides and sodium nitrate with the or ammonium nitrate. The last equation shown for the epoxides. The epoxide in this equation, according to the reference Turkey-German chemistry 209, and the product will be nitroxy alcohols. Can the reaction proceed via two mechanisms, two steps, and we can get two products. One will be major and another will be minor. The compound 2 is the main product, the major product, because it's less hindrance. Physical properties of nitroxy alcohol derivatives also can be used here. How can we detect the NO2 from series 1, series 2, and series 3? The best method will be used, analytical method will be called class assay, used for detection NO liberated from the cysteine as reducing agent. The mechanism for the protection or assay for nitric oxide donors will be nitrate with the L-cysteine 2 molars in the buffer conditions, pH 7.4, lead to the NO2 plus cysteine derivatives. This is the calibration curve of sodium nitrate at 540 nanometer. This is the COX. Our conclusions: nitric oxide donors compounds are organic and stable at high temperature. Secondly, all reactions should be done in the dark and cold places because it is exclusive. Third, more than 100 products were synthesized. And the percentage will be medium, about 40 to 60%. Also take at times the detection will be using for nitric oxide using trace methods. Our acknowledgement to the Professor Tilka, Fouansat Tilka for the Faculty of Pharmacy, University of Paris 5, France, for the NMR analysis. Also to the Dr. Hana for the mass faculty in the UK. This is my country, Nineveh, Muslim Iran, and thank you.
Thank you, Dr. Faris. We have maybe time for 2 questions, please. Any questions? Okay. If not, we'll go to the next presentation. Thank you, Dr. Faris.
Well, this talk will be given by Dr. Mohammed Web. Dr. Mohammed Web is a lecturer in Harvard University in Palestine. He has a BSc in pharmacology from Al-Quds University and MSc in clinical pharmacy from the University of Jordan. The title of the talk is Assessment of Community Pharmacist Inhaler Counseling Techniques.
Assalamu alaikum. My name is Mohammed Wade from Harvard University. My presentation is about a study that we conducted last year, assessment of community pharmacist inhaler counseling techniques. Asthma is a heterogeneous disease usually characterized by chronic airway inflammation. It affects about 1 to 18% of the population in different countries. In Palestine, the percentage is about 10%. Symptoms and airflow inflammation may resolve spontaneously or in response to medication and may sometimes be absent for weeks or months at a time. As we know, asthma is a chronic disease, so it may have remissions and relapses from one time to another. For every asthmatic patient, assessment of asthma should include the assessment of asthma control, both symptom control and future risk of adverse outcomes, treatment issues, particularly inhaler technique and adherence, which is the subject of our study, and comorbidities that could contribute to symptom burden and poor quality of life. Inhaler mishandling continues to be common in outpatients referring to just clinics and associated with increased and scheduled healthcare resource use and poor clinical control. It's one of the most important factors or issues in asthma treatment. Instruction by healthcare givers is the only modifiable factor useful for reducing inhaler mishandling. The aim of our study was to evaluate community pharmacists inhaler counseling using a validated list or 2 validated lists. We have chosen 100 pharmacies from about 160 pharmacies in the area of Hebron, city camps and villages. The method that was used is simulated client, where a simulated patient visited the pharmacy holding an inhaler, 1 or 2 inhalers. She asked the pharmacist to teach her how to use the inhaler, claiming that she obtained it from another pharmacy or another source, which did not teach her how to use it. The technique of the pharmacist was compared to a validated checklist. They were divided into 2 groups, one turbohaler 50 for turbohaler and 50 for an aerolizer. We used Symbicort and Foradil. These are the turbohaler and the aerolizer. These are the checklists that we used. We obtained them from the leaflets of the Symbicort and Foradil, and then we compared them to previous studies to make sure that these lists are valid and are true and are complete to be used by the patient during his use of the inhaler. These are very simple steps that should be with every pharmacist to be able to teach the patients how to use the inhalers. The results were surprising for the turbohaler. The first step was remove the cap and hold the inhaler upright. It was given by only 78% of the pharmacists. Step 2 is twist the colored base in one direction and back it again till you hear a click to release the dose. It was given by only 60% of the pharmacists. Breathe out fully before using the inhaler only by 14% of the pharmacists. Sealing the lips and the teeth around the device, it was given by 30% of the pharmacists. Inhale hardly and completely by 66% of the pharmacists. Take out the inhaler and hold your breath for 5 seconds. It was given only by 16% of the pharmacists. This is a very critical step in using the inhaler, because without this step, the drug will not be in contact with the site of action for an adequate duration. The next step was breathe out slowly and gently, also not to expel the medication quickly. It was given by only 6%. And, sorry, it's not discard the capsule, it's wash your mouth. I have a mistake here. It's wash your mouth. It was given by 6% of the pharmacist also. For the aerolizer, 10 steps. The first step was remove the cap, 66% of the pharmacists. Hold the inhaler and turn the mouthpiece in direction of the arrow to open the device, 72% of the pharmacists. Place the capsule, 88% of the pharmacists. Squeeze the two buttons inwards to release the dose from the capsule by 86% of the pharmacists. Breathe out fully, 12% of the pharmacists. Insert mouthpiece, sealing lips and teeth around it by only 16% of the pharmacists. Inhale deeply and quickly, only 74% of the pharmacists. Hold your breath again for count of 10 or as long as it's comfortable by only 6%. And breathe out gently, 2%. Sorry, I have another mistake here. Discard the capsule, it's 4%. In order to evaluate all the numbers, we have divided the steps into poor skills, good skills, and excellent skills based on the number of steps that were done correctly by the pharmacist. For the turbohaler, if he has done 1 to 5 steps out of 8 poor skills, good skills if he has done 6 or 7 steps, and excellent skills for 8 steps, 8 full steps. For the aerolizer, 1 to 5 poor skills, 6 to 9 good skills, and 10 steps were considered as excellent skills. 92% of the pharmacists that counseled about the use of turbohaler were considered as having poor skills. 6% as having good skills and 2% as having excellent skills, meaning that only one pharmacist out of 50 did the steps correctly. For the aerolizer, 78% had poor skills, 22% good skills, and 0% of the pharmacists done it correctly. So, different studies in different countries have revealed similar results. pharmacists have limited knowledge about the use of inhalers. Why is pharmacist knowledge important? Because they are the last line before the patient. Good knowledge of the pharmacist will lead to positive impact on the patient treatment. So for every pharmacist, he should do more than one strategy to ensure effective use of inhaler devices by the patients. First, check inhaler technique at every opportunity, at each time you see the patient. Ask the patient to show you how they use their inhaler. Don't just ask if they know how to use it. Let the patient use it in front of you. Identify any errors using the device-specific checklist as we saw before. Then the pharmacists have to correct. Show the patient how to use the device correctly with a physical demonstration using a placebo inhaler that are distributed by the manufacturers. Check technique again, paying attention to problematic steps. You may need to repeat this process 2 to 3 times to make sure that the patient gets the full series. Only consider an alternative device if the patient cannot use the inhaler correctly after several repeats of training. And recheck inhaler technique frequently. After initial training, errors often recur within 4 to 6 weeks because patients might forget how to use the device. So, the recommendations: effective asthma management requires a partnership between the person with asthma and their healthcare providers. Teaching communication skills to healthcare providers may lead to increased patient satisfaction, better health outcomes, and reduced use of healthcare resources. As for the communication skills, one of the pharmacists refused to teach the patient because she did not sell it. She told the simulated client to go to the one who sold you and let him or her teach you how to use it. The regulatory and licensing authorities should assist the skills of the community pharmacists in the use of inhalers, and newer, more novel methods of education should be investigated. And for our future work, we will take a larger sample, of course, and we will assess 2 newer methods for education of pharmacists using simulated client also. As a difference from the conventional methods of lectures and medical reps. And that's it. Thank you. Thank you for listening.
Thank you, Mr. Mohammed. Any questions?
Yes.
Do you think that these steps are equally important for delivering the drug to the patient?
No. There are critical steps and less important steps. So if we are talking about holding the breath, for example, it's so important. And if we are talking about opening the device, it might be مفهومة ضمنا زي ما بيحكوا logical. But yeah.
Good, excellent, etc.
Yeah.
To the number of
Correct steps. Yeah.
If the step is not so important, such as discarding the capsule, we cannot calculate it as a part of good, excellent technique.
It's important, but not as important as other steps. We have done more analysis of the
I
results.
think you need another method to assess is that technique is really good or excellent by executing the steps which are not.
We might do that. Thank you. Thank you.
I have 3 questions. So my first question is, how did you know that you're concerned to patient, female patient, when it's facing the pharmacy? How did you make sure that you both ask for the pharmacy and then you don't access the pharmacy?
This was done in April. The Palestinian law states that a pharmacist has to be always in a pharmacy, not a technician. It's not always applicable, but most of them were pharmacists. As we know, it was done in the day, which is the time when pharmacists are always there. We cannot make sure that it is a pharmacist, but mostly they are pharmacists because it was done during the daytime. Yeah, the simulated patient was a 5th year pharmacy student. Yeah. Yeah. Yes.
And like this is a really important question.
Yes, we are planning to do another study, another large study using training. I have read studies. One of them was done by Dr. Iman Bashidi. They invited pharmacists to lectures to train them. Anyway, there was improvement, but it was not that big improvement. So we are thinking about another method, another two methods to see if they were better than just taking lectures.
Because it's important that
Yes.
this is really important
Yeah.
and finding out this information. But what are we going to do with this information afterwards?
Thank you.
You're not gonna,
No, just like
Oh.
the time.
all right. Well, maybe afterwards, you could seek him out. Thank you.
Okay, thank you.
Thank you very much. Our next presenter is Dr. Iyad Ali. The title of his presentation, The Prevalence of Metabolic Syndrome in Schizophrenic Patients, Impact of Antipsychotics. He's from the Faculty of Medicine and Health Sciences at the Najaf National University in Nablus, Palestine. He's received quite a few awards as recent as being a Fulbright Senior Research Scholar in 2013, 2014 at Wayne State University in Detroit, Michigan. He received fellowship also to Essex University in the United Kingdom, Scientific Research Coordinator 2014 until now at the Faculty of Medicine at the Najaf University. And he received a Najaf Research Award and also an Indian Council for Cultural Relation Fellowship in 1993. Welcome.
Thank you very much. Assalamu alaikum everybody. Good evening. First of all, I would like to thank the Faculty of Pharmacy at the Zaytuna University and our friend from Toledo University as well for organizing this conference. My talk, as you can see, is the prevalence of metabolic syndrome in schizophrenic patients, the impact of antipsychotics. Before going into the subjects, I would like to say something about the medical research activities in the Arab countries. So, in a study done by Jaluk et al., this study was published in 2012. He reported that more than 21 Arab countries, they have published research less than Iran. And I want to compare the Arab countries first of all with Iran because Iran is located in the same area and suffering from the same crisis. So this is about the medical research. And if we come to the mental health research, it is more neglected. And in a study done by another author, Ben Amer, he said Arab nations lagging behind other Middle Eastern countries in biomedical research as well. And different studies, they have studied the productivity in medical research in the Arab countries. And he said that Turkey itself, Turkey alone, has published as twice as 16 Arab countries in medical research. And in Arab countries, we have more than 300 million. The population is more than 300 million, while Turkey and Iran is much less than that. So the medical research is neglected, the mental health research is more neglected. That's why we thought to study or to do some attention to make some attention about the medical research activities in the Arab world. And this, from here comes the significance of our work. I'll go to the subject directly without wasting much time. Our research was conducted in Palestine on schizophrenic patients. As you know, schizophrenia is a mental disorder affected approximately 1% of various populations throughout the world. So, and this comes the story of one person. Some people, they think 1% is so little. But if you ask the previous president of the United States, he will tell you how much the 1% is important, because he won the election by 1% over Al Gore, and he was the president of the United States for 4 years. The patients with schizophrenia are reported to have shorter lifespan compared to the general population. And the most common cause of this short lifetime is cardiovascular diseases. And there are even books written about the metabolic disorders and cardiovascular diseases. Cardiovascular diseases is defined as when the patient is having at least 3 main problems: insulin resistant, high blood glucose, obese, overweight, abdominal cholesterol level is high, whether it is low HDL or low LDL. So why we are interested to study the metabolic syndrome? Because it is well reported and it is documented that the metabolic syndrome is a major side effect of antipsychotics, which is used in the treatment of schizophrenia. So according to the WHO recommendation, they say one antipsychotic should be prescribed at a time in individuals with psychotic disorders. And this recommendation is considered, the strength of the recommendation is strong. But they say for those patients who do not respond for adequate dose or duration, more than one antipsychotics medication, you can use a combination therapy. You can use a combination therapy. That means include or use more than one antipsychotics for those patients or for this patient. But the recommendation strength is conditional. In the globe, different health agencies, they made guidelines for the schizophrenia treatment, and all of them, almost, they recommend for more monotherapy and not for the combination. No one advised for use of combination therapy with these patients. But the fact is much different than that. Our project was for nursing students doing their master's degree in community mental health, were used or they were employed for doing this project. The purpose, as I said, was to investigate the prevalence of metabolic syndrome in schizophrenic patients treated with antipsychotics. The project were done in or carried in the West Bank of Palestine. I don't know whether it was surprising or not, but we found that more than 50% of the